what I'd really like to discuss now is kind of that important thing of communication. And actually, Roberta and Dave, you've perfectly segued into that. So Anib, if I can come to you, how did you find the communication between yourself as a medical professional and Pharma, and what were the limitations and challenges of that you experienced?
So for the last EAP, it was very helpful in the beginning. So there was good contact made by the local pharma people to the global pharma team. But then it became a bit difficult because we had different expectations. I was expecting that it was not that much of work, but the pharma company, they expected feedback every week or every second week regarding the patient's state and some side effects, possible side effects. There were no side effects. And I found it a bit difficult because we don't have that much time, and was also not expecting to put in that much time for giving feedback. I appreciate, of course, that real-world data are really important for the pharma companies and also for science, of course, and for patients. But this makes it sometimes a bit difficult.
Yeah. Were you able to feedback? Were you able to feed back to them that was onerous and adjust the way that you know, the mechanism there? Or
yes, well, they had a fixed mechanism, so it was a bit difficult to make it more flexible. But then in the end, it worked out quite well.
Sure. Okay. Thank you. Very insightful. Thank you very much. So Dave, carrying on the theme of communication, obviously it can be really difficult to communicate with patient groups around the sensitivities of inclusion, exclusion criteria, geographic scope, kind of managing expectations. So have you got any examples of how you've effectively managed that in projects that you're working on, and how that can be kind of employed across other groups?
Sure. So in the U.S., you know, we have the 21st Century Cures Act, where the biopharma companies are supposed to be putting the information about compassionate use early access on their website. So that's something that you know, patient organizations can really look to and try to see. Another is really, as we said earlier, really connecting with the patient advocacy groups and trying to get a sense of all that. The other is working very closely with the medical and clinical team to understand, you know, the enrollment, where we are, what's going on. Part of it is also educating them that, you know, there is a need out there, because not everybody can do the clinical study. Not everybody is eligible for the clinical study, even if they have the disease. So making sure that there's that dialogue going on internally with that. An example I can provide is, you know, if a patient connects with me directly, what I try to do is find out with that patient, and again, I get their consent in regards to who their HCP is, who are they working with. And then I try to connect that HCP with one of our medical or clinical folks to really have a dialogue with that, to see if the patient, you know, is eligible for study, or if not, if they can hear that there's a need for the EAP program. Obviously, also working closely with some of the regulatory agencies, you know, whether it be the FDA, EMA, you know, Health Canada, all of that, understanding what those are. I think one of the most important things, though, is really building, as Roberta and I have said earlier, really building that connection and getting a sense. Don't be afraid to reach out to the patient organization. And as Roberta said, you know, stay in touch. I mean, we all know that, you know, things go up and down regarding how the trials are with the, you know, the clinical data showing, and also the timing of things. You know, it sometimes takes a long time to get programs up and running. So as long as they're aware of that and what we need to do.
Yeah. And ultimately putting in that work at the front end to manage those expectations and have really good communication just helps iron out any of the negative pitfalls that can come further down the line. So absolutely fantastic. And
One of the things,
carry on.
Nicole, I did one of the things was also in regards to a lot of the times with clinical studies, you know, the companies have set up processes to really help a patient, a caregiver, making sure that they can get to a site and all that. And sometimes, you know, the patient organizations aren't aware of that, and nor is their HCP. So that's why having the dialogue and the multiple, you know, it's a multidimensional approach for communication.
Do you find it more difficult to get into the HCPs? You know, if they're not aware, is it more difficult to get that level of kind of communication? Are they happy to communicate to patients on your behalf, for example, or is that a difficult route of communication?
Well, sometimes it can be difficult. Sometimes I have to do a three-way conversation, you know, that the patient has given consent and all that. But generally, especially with the rare and ultra rare, there really is, you know, everybody's trying to figure out what's best for the patient and what can be done. So
yeah.
Nicola, can I add into that? You know, EAPs have a very tumultuous process, and there's a lot of paperwork involved. There are a lot of steps. And one thing, and I'd like to touch on kind of what Dave said, you know, these processes aren't always perfect. And unfortunately, some of the patients can feel stuck in that process. And a big role of patient groups like ours or any nonprofit that's helping with this is when people complain, they do it in the groups. If the process is stuck, we can help them, you know, understand and communicate that back to the EAP contacts to help them understand that something is going on at a certain EAP site, or, you know, something has lagged. And it really helps open the door to troubleshoot any issues that they may not know about on their end versus what the patient is seeing on the other end. So it could be such a help, you know, evolving the EAP process for a family.
And those groups are really important because I'm assuming that there's a level of nervousness around feeding back anything negative for fear of, well, if I'm perceived to be complaining, I'm not going to get access, you know. And so having those groups to kind of vent that, so that then you can, okay, take that still a little bit and forward it on, you know, anonymously or in a appropriate way. I mean, is that part of that sort of element?
Absolutely. We never realize it when we get into it, but we're sort of EAP counselors. we help the family say it's okay, and we will get through it. Let's open up dialogue. Let's troubleshoot and get you through this. And we know through a long relationship with companies that we don't overpromise. We really try to manage expectation and never promise something that can't, you know, that's not reasonable. We don't do that. And I think there's a stigma tied to that thought of, you know, patient advocacies may sometimes cross the line and get too involved. But, you know, and I understand that. But in the same aspect, we really can, if the company helps us set the expectation, then we set it for the patient. And that's very important.
So before I go to Dawn on a question, I just wanted to ask there then, so Anib mentioned about the kind of the onerous nature of being involved. So as a charity, how is that for you? Because you're taking on quite a lot of that communication and that. How do you manage that? You know, when often this is not the day job and you're juggling it with other things. Yeah. Does that become a big burden on the charity when there is an EAP in place and you're having to do this extra work?
I don't ever feel that a burden is the way it comes. I mean, Estonia, the Estonian family, I have to text them in the middle of the night because, you know, but that is not a burden to me because I can see the positivity and the effect in the community and how these families' lives change when they have these medications that they need. They're hungry for information. They're hungry for help. And when they finally get it, it's a blessing. And if I or the organization is a conduit to that success, so be it.
Sure. It's a toll though, isn't it? It's another thing that needs to be considered that, you know, yeah, for sure.
And if I can jump in, sorry, Dave, sure, if I could jump in there just to kind of elaborate a little bit more on what Roberta was saying. I don't think any of us who are in the support space, whether it's the pharmaceutical support, the patient support, I don't think any of us look at what we do as a job. It's not a punch in. It's a mission. We're to Roberta's point. Yes, those phone calls are happening at midnight, 2 a.m., 3 a.m. We you know, and to Dave's point, communication is with key stakeholders all in all time zones all over the globe. We make that commitment.
Yeah.
So we want to be here for the patient. And you tend not to last very long if that's not where your heart is.
Yeah. Well, I think that comes across loud and clear, the fact that so many of you are on holiday while taking part in this room.
Well, the hard part is we always have to wait until the morning business hours for the company communication.
So, Dawn, could you expand as well in terms of what industry can do to support patients, healthcare providers, and patient groups to help them communicate better around these sensitive topics?
Well, we definitely touched on it a bit. I mean, posting our policies on websites is, as a company, that really, I mean, it's a rule. We need to do it, but I mean, it's fundamental. It's that first step, and clearly identifying who and how to contact with questions, and having the who and the how for both physicians, for patients to know who they can contact within the company or how to contact within the company. And on the flip side of that, internally, assuring that all the communication teams are able to identify who is sending them questions and to route those questions appropriately and respond. And that's where I stand on my soapbox.
Yeah.
You have to respond, and you have to, as a company, don't be afraid to respond, and make sure your inner teams respond. Reach out, as we were saying, reach out to, if you have an internal advocacy group, have them go ahead, connect with the patient, connect with your physician teams to talk to the physician. Just don't be afraid to communicate.
Yeah.
And I'll second that with John.
Yeah.
And keep after it.
Yeah.
Things get so, it's not intent in regards to not responding. It's just things can get lost and all that. And so, do it again and again and again, and also use the old-fashioned way. There is something called the telephone that you can actually talk to somebody. So.
We do forget that, though, don't we? We can still pick up the phone.
Patient groups can be very resourceful. Can't we, Dave?
Yeah.
Yes,
sure.
and not only that, and I'm looking at John as well. I mean, we've got patient groups, we've got physician groups, but we also have other partners in industry, and groups such as the Tanners, who can help us additionally get information, reach out. They may have people that they know who are closer to an institution who can help us answer questions. One of the little challenges, communication is always key, but what happens if I don't communicate in the same language? Yeah. So that's where you also additionally need to lean on your colleagues, whomever they may be, who are in a space where they can translate this for you. And again, keeping the communication, but keeping it in a way that you can understand what's being asked, and what needs to be said is understood on the receiving end.
Absolutely.
Yeah, just to comment on that, I mentioned in my opening about collaborative partnerships and the importance of that, and that's really, I see, fundamental, and looking at whether it's advocacy groups or NGOs or physicians, hospital, there are just so many stakeholders that are required, especially, it's one thing if we're just talking about going into mainland countries, but oftentimes we're not. And so, what are the mechanisms and processes, and the beauty of this is stakeholders, oftentimes are very aligned in terms of wanting to do good for patients. And so that's very, very helpful.
Yeah. Fantastic. Thank you, John. We're going to go on to another poll now. Becky, if you want to pop that up. So can early access programs help bring more equitable access to medicines for people with rare diseases?